I'm Sara. I'm from Pakistan, and I am the co-founder and CEO of Sehat Kahani, which means Story of Health. So I was born in a very typical middle-class Pakistani family. My father left his house at 18 years of age, had to earn, so could not complete his education. My mother, 21, graduated, married my father. So my parents had one thing in common. They were middle class, and they had dreams of middle-class parents back in Pakistan. That is, to earn, to educate your children, and to get them to a postgraduate education. But there's a very interesting caveat to this scenario in my country. So when middle-class parents have money to educate their daughters, they almost always want them to become doctors, because it raises your social stature, it makes you more noble, and it gives you the best hand in marriage. So my parents, at the age of 5, told me that I had to become a doctor, no other choice. So for the next 14 years, I practiced getting into a medical college. And when I finally went there, I was surprised to see that 80% of my class was made up of women as well. And that's not a normality in Pakistan, where men dominate universities. And I realized while talking to them that all of them had been fed the same dream that my parents had fed me when I was 5, that if you become a doctor, you become more noble in your society. But I saw a very interesting transition in their lives as they started to move forward. And there's a phenomena in Pakistan this interesting scenario has. It's called the doctor bride phenomena. We make a lot of doctors in the country so that they can get an education to get married, but once they get married, they don't work. And I saw that in my peers, that as 5 years of medical college went through, a lot of them left their work, became homemakers, became housewives, and did not work. And when I did my last year of my clinical practice in my medical school, where you actually do practice being a doctor before you're let out in the world, I saw the implications of that. So Pakistan has 220 million people. We're the 5th largest population in the world. Half of our population never sees a doctor in their lifetime. A huge problem in that is that female doctors do not work and reach them. And then I saw a lot of patients coming to a tertiary care hospital just to die comfortably. They had issues that could have been dealt at primary healthcare level, but because there was no doctor in their community, it just couldn't happen. And with that irony in mind, I realized that Pakistan has half a doctor for 1,000 patients. Half a doctor. So as life continued, I graduated. I also became a doctor bride. I got married in 3 months. The difference in my journey was that as soon as I got married, I started my residency in radiology. I became pregnant. I had to quit my residency. I was devastated. And in that time, just not to be at home, I joined a primary care clinic in a slum in Karachi, where I live in Pakistan. I live in the largest city of the country. And that is when I realized what value does a doctor being in a community add. So when I started working in that community, patients' healthcare issues were being managed at primary healthcare level. And it was great. But unfortunately, I had to shift cities. So after having my first daughter, I moved to Lahore, which is another city in Pakistan, and realized that I finally had become the doctor bride. Now, I could not work. I could not leave my child at home. And that pushed me into severe postpartum depression for 8 months, to the point that I hated myself, I hated my child, I hated my life. And in that time, the only thing that saved me was a call. So I got a call from my nurse who used to work in my clinic. And she said that you've gone in this slum, we can't find a female doctor to replace you. So what should we do? So I said, okay, I was bored, and I was desperate, and I was depressed. So I said, whenever a patient comes to you, you take me on call. And a week later, she reached out and she said, this is not working. They need to understand who is talking behind the call. And then she stuck a webcam on her laptop, and we started doing online consultations. Her being in Karachi, I being in Lahore with the patient. And that's when I got the concept of Sehat Kahani as I stand today. That why not create a digital healthcare platform that allows all female doctors in my country to connect to patients across Pakistan using a chat, audio, and video consultation platform. And that's what Sehat Kahani is. Sehat Kahani is a telemedicine platform that connects online patients to doctors using a clinic model in low-income areas and a mobile app. But when I started, I was just a 26-year-old doctor. I had no money, so I got my first $25,000 in a grant, and I started. I launched my first clinic in 6 months. It did wonderfully well. I was amazed that I could do so well without any formal business education. The next clinic I opened tanked, to the point that I got death threats from the community, because for them, telemedicine was a threat. It wasn't an opportunity. I had not done my due diligence. So then I made a vow to myself that if I do this, I will make this the best telemedicine organization in Pakistan, and myself the best founder to do it. So I enrolled myself in different courses. I did my master's degree. I did a few fellowships to make sure I was up to the mark. And in 2 years, we made a network of 8 clinics. They were doing reasonably well. We were training nurses across Pakistan for a laptop and a software that can connect them to online doctors. But one thing was missing. We were not creating impact at scale because the clinics were limited to that community and the impact was also limited to that community only. So then me and my co-founder, 2 years senior at this time, thought that we would also create a mobile application that will allow anyone in Pakistan to download it and connect to a doctor. One more ambitious thing that we thought at that time was, because we had seen in our clinics how instant consultation reacted, we thought that whenever patients come to us on a mobile application, we will connect them to a doctor in less than 60 seconds. And with that ambitious vision, we made the application. And the application launched in Pakistan in 2020. Telemedicine was an alien concept. Even food delivery and ride-hailing were very new in Pakistan at that point. But one thing that happened good for us, became an opportunity in the crisis, is that we got picked up by the government in 2020 as the first responders in COVID care in telemedicine. We did 110,000 consultations on our app, and patients from 11 countries use Sehat Kahani application. Even the Pakistani diaspora in Malaysia, Thailand, Hong Kong used it. And that's when we realized that this app has the potential to actually give the opportunity of people not only to access to healthcare, but also affordability, quality, etc. And then we launched our app for 2 markets. So our app in Pakistan is used by consumers. People like you and me can download and use it. But it's also used by a large corporate market in the country for their corporate employees' well-being, both physical as well as mental well-being. And we grew. So in 2021, we raised the first pre-Series A round by any female founder in the country of $1.2 million. Today, as we talk, Sehat Kahani has become one of the leading telemedicine platforms in Pakistan. We have 59 clinics across the country in all 4 provinces. We have 700 plus corporates that use Sehat Kahani app today. That's 3.2 million corporate employees and their families. We have 1.4 million users on our app, and we've done over 2 million consultations. And during this time, we have created a network of around 7,500 female doctors that are working across the globe providing telemedicine solutions on our app and on our clinic as well. In 2022, Sehat Kahani got named as the only company from Pakistan to make Forbes 100 to Watch Asia list. And it's been 6 years of me doing this. It hasn't been easy standing here in front of you today, but being a female leader from Pakistan, being a mother, being a daughter, being a wife, making sure that everything is afloat, it's not an easy journey. But I think what gives me strength of doing this every day is that when you see a thyroid cancer being diagnosed on call, when you see a suicidal patient from the bathroom reaching out with his parents in the other room to a psychologist, when you see 18 years of infertility being treated online by a doctor, when you see malnutrition, heart failure, diabetes being managed over time, just on video consultation, that's where we get the motivation. I had no right idea to run a company. I only have my way of running Sehat Kahani. And my way from the day first involved many people that created this village of partners, mentors, funders, donors with me. I learned from people that I work with, and that's why I'm here today. I'm here to tell you what is the ambitious thing that Sehat Kahani is doing next. So we think that this is not just a solution for Pakistan. This is a global solution that could be scaled in many, many other geographies where there's a lot of doctor-patient disparity. So for the next 6 years, we are now embarking on a journey to make this solution be available in 11 countries by the next 5 years. And I'm happy to share that I'm open to any collaboration, growth opportunities, any advice that you have to make that dream possible. I truly believe that everyone should have access to democratize healthcare, and let's do it. Thank you.